I thank you for holding a hearing on this important bill. As a retired pediatrician and a member of the Universal Healthcare Work Group, I strongly support this bill, 5399, with a bunch of letters and numbers in front of it. In essence, this bill would start implementation of what the majority of the work group favored: a unified, publicly funded plan for universal coverage, health coverage through a state agency such as the Healthcare Authority. I do have a couple of suggestions. Number one, there is no mention of a chairperson for the UHCC, the commission that would be formed by 5399, and there needs to be a good leader. Something to consider is inviting an outside expert on healthcare systems to come to chair and lead and help guide the group. This has worked in some other states and countries that have wrestled with this problem. So it's something to think about, although it would cost money. Somebody like that wouldn't come for free. Number two, completing the work by late 2024 is too much time. The Universal Healthcare Work Group should be able to meet a 2-year deadline, which would be changing the date from November 1, 2023 to changing it to 2023 from 2024. In case somebody wants to know, it's on page 3, line 22. Okay. Number 3. Recommendations for short-term fixes should not have to wait 2 to 3 years for the final UHCC report. There are people who are hurting now, and we can do help now, especially those who are undocumented or those unable to afford any health coverage currently. Both SB 5377, the Cascade Care Bill, and the federal $1.9 trillion bill, whose name it constantly escapes me, that just passed Congress, they make some short-term help, mainly by shoveling taxpayer dollars directly to insurance companies. These fixes won't work long-term. They won't make long-term solutions, and they do absolutely nothing to control costs. But they can be of interim benefit while the UHCC does its work to write long-term program. The stories heard in earlier testimony have a common cause. Our healthcare system is run as a business, caring about prices, costs, and profits, instead of being designed to provide the care that patients need when and where they need it. Universal coverage run through the Healthcare Authority will be able to focus on patient needs first and foremost, and will cost quite a bit less thanks to than is currently being spent, as the work group report shows. I would be happy to work with this committee to deal with these concerns and suggestions if you wish. And I wish to emphasize again that, imperfections and all, I strongly support this bill. Thank you very much.